And now, stand-up community subscribers and listeners from around the globe, it's time to Stand Up with Pete Dominic.
Yeah.
Where we ask the important questions that impact you, your family, and your community.
That's right.
Such as, will Chinese tariffs negatively impact my business income from selling bootleg DVDs?
Fair question.
And will meat production facilities finally require vaccinations for their workers but still manage to give me Campylobacter?
Yes. What?
And now, the podcast host who will always share his pickled cucumbers but never his cold virus, Pete Dominic.
Yeah, that is right. You nailed it again, Pete, and thank you very much for joining me. Hello, and happy Wednesday to you. It's the first week of August. I'm happy to have you joining me. I'm very happy to have two excellent guests on the program today. The great Dr. Aaron Carroll answers all of your questions related to the vaccine and COVID and a little more. And S.E. Cupp joined me to talk about Andrew Cuomo, the insurrection, and the way that women are subjected to a different kind of criticism when they are at the top of their game, and much, much more. Very excited. Dr. Aaron Carroll and S.E. Cupp, and I've got you, and I appreciate you bringing yourself over here to the podcast today. Tell your friends, support it with a paid subscription if you haven't already. I will be taking next week off, still planning on posting an episode every day ahead of time, though, so look out for those interviews only next week. And tomorrow night, I'll be hosting the Hangout as per a regular every Thursday at 8. Stand-up subscribers, the stand-up community hangs out. We always have a great time. Hope to see you there. But right now, it's time to get to the news segment, a little something I call the last 24. Yeah, so we got to start with, I've got Cuomo, COVID, and a couple of other things to share with you here. But of course, I've got to start with the news that broke early Tuesday when the Attorney General of New York State announced the findings of her investigation into all the accusations against my governor, the governor of New York, Andrew Cuomo. And here's just a small piece of what that sounded like.
The independent investigation has concluded that Governor Andrew Cuomo sexually harassed multiple women, and in doing so violated federal and state law. Specifically, the investigation found that Governor Andrew Cuomo sexually harassed current and former New York State employees by engaging in unwelcome and non-consensual touching and making numerous offensive comments of a suggestive and sexual nature that created a hostile work environment.
That's just a small sampling of the impactful statement that the Attorney General, Letitia James, and I thought she came out really sober and honest and believable and with integrity. And Andrew Cuomo, of course, is now, I think it's fair to say, disgraced. I mean, will he resign? Doubtful. Will he be impeached? Looking likely. And pretty much everybody who has an asshole has an opinion on this and everything else. But I think the New Yorkers count the most, of course, because we're his constituents. And so I want to give you the mayor of New York, who there's no love lost between these two. But here's a quick clip from Mayor de Blasio on Cuomo.
The summary you just gave represents behavior that's unacceptable. Unacceptable in anyone, let alone a public servant. I've been very clear about the fact that what we've seen is disqualifying. I'll look at this report and have more to say, but it's very, very troubling and painful to hear that accounting of a powerful person treating people that way.
All right, and now let's listen to my Congressman Mondaire Jones, who weighed in on CNN.
And this is something that no one should ever have to experience. I'm also thinking of my sisters and my friends who work in politics and all of the people who are at risk of people like Governor Cuomo's conduct. And we have to stop this. We have to set a standard. And I'm hopeful that we can resolve this in short order at the legislative level, if nothing else. in terms of removing him from office.
One way to set that standard is to elect women, just saying. Well, Governor Cuomo, for his own defense, released a video statement along with a montage of him and other people hugging people, other prominent politicians, and this is just beyond pathetic and a crazy defense. But in this whole clip, he's talking about how he learned this from his mom, this kind of touching. He's talking about putting his hands on people's faces and hugging and giving them a kiss. Well, he also grabbed their ass and ran his finger down their back and said a whole bunch of things. But nonetheless, here's just a little bit of the governor of New York, who has fallen so far in a year right now.
I've been making the same gesture in public all my life. I actually learned it from my mother and from my father. It is meant to convey warmth, nothing more. Indeed, there are hundreds, if not thousands, of photos of me using the exact same gesture. I do it with everyone, black and white, young and old, straight and LGBTQ, powerful people, friends, strangers, people who I meet on the street.
Yeah, well, none of them are the ones we're talking about who accuse you of much more than that, or that in addition to other circumstances. And now here's a little bit more from Andrew Cuomo out on the street after the press conference. And I mean, this clip, he actually sexually harasses women while he's talking to cameras. I realize the volume here is a little low, but it really is outrageous.
I just wanted to say that the allegations against me, hello, Hubbits, the allegations of me sexually harassing women could not be more false. Did you ever have Italian sausage, ma'am? And I will fight these charges with every breath that I have, even if I require a ventilator. Did you ever have a cannoli? So as you can see, totally false. And Big Bird Blasio City is a total hellhole. So if there are no more questions, I will talk to you later.
All right, there is fake Andrew Cuomo on the street. And now let's listen to the former disgraced president. This is pretty outrageous, but yet unsurprising. Here is Trump reacting to Andrew Cuomo, who has a lot more in common with him than maybe folks once believed.
What we're here to talk about today is the disgraceful sexual harassment of Andrew Cuomo, the way he's treated women. Totally disgusting. I would never talk or treat women like this. But you have Sleepy Joe coming out like he has authority. And somebody puts a paper in front of him and he reads and says, you know, come on, Jack. And then says, Angry Andrew's got to resign. Now, Angry Andrew is disgusting, but he's not going to listen to Sleepy Joe because he knows Sleepy Joe has no authority. I do, though. As the Constitution of Mar-a-Lago says, I'm actually still the president. And I'm calling on Angry Andrew, and while we're at it, his brother, Christopher, to get the hell out of town, okay? I'm reading these reports about how he was harassing women, and it was disgusting. He never once sealed the deal, okay? So this is somebody so weak, and he got caught, and that's two things I don't respect. Somebody who doesn't seal the deal and somebody who gets caught.
Yeah, he hates when people get caught. He has no respect for those who get caught or captured. Okay, and now let's go to the real president. This is President Biden, who gave a press conference. Ostensibly, it was supposed to be about COVID, but of course, he did take questions, and one of which was from CNN's Caitlin Collins, who asked him if he would stick to what he said earlier this year, which is that if an investigation turns up that there are credible allegations of sexual harassment, Andrew Cuomo is going to have to resign. Here's this moment.
You said that if the investigation confirmed the allegations against Governor Cuomo, then he should resign. So will you now call on him to resign, given the investigator said the 11 women were credible?
I stand by that statement.
Are you now calling on him to resign?
Yes.
And if he doesn't resign, do you believe he should be impeached and removed from office?
Let's take one thing at a time here. I think he should resign. I understand that the state legislature may decide to impeach. I don't know that for a fact. I've not read all that data.
And he's using a photo of you embracing him in his self-defense to say that these are commonplace kind of embraces that he made and the allegations against him. Do you condone that?
Look, I'm not going to fly-spec this. I am sure there are some embraces that were totally innocent. But apparently the Attorney General decided there were things that weren't.
All right, there's some sound bites from the important players on the Cuomo scandal yesterday, and I'll talk more about that with S.E. Cupp coming up. I do just want to say I was sadly unsurprised about the findings of this investigation. It was worse than we thought, but still not surprising based on this man's behavior. His entire life, he's always tried to intimidate people, everybody, to walk all over people, take advantage of them. He's just not a good guy. He really never has been, and he's always been a bully, and I've never liked him as one of his constituents. I grew up with his family. I like his brother, Chris. We always had an interesting but good and respectful relationship when we worked together at SiriusXM, shared a studio. He always came in after I did, and he was there for me after I lost my gig, and so that's a little bit more complicated. Nonetheless, he didn't even cover the news about his brother in his block on CNN last night. That seems like journalistic malpractice. I'm sure he'll explain that at some point, and I'd like to hear it. But I really was disgusted by this guy, and I know many of you probably are as well. But we'll come back to that with S.E. Cupp later. Let's move on to a more important issue, and that, of course, is COVID. Here is the director of the White House COVID-19 task force. His name is Jeff. Is it Jeff? Yeah, Jeff Zients, along with Dr. Fauci and Dr. Walensky of the CDC. Here he is just presenting a quick clip of the latest data.
The 7 states with the lowest vaccination rates represent just about 8.5% of the U.S. population, but account for more than 17% of cases. And 1 in 3 cases nationwide occurred in Florida and Texas this past week.
All right. Frightening and terrifying for those areas that are still under or unvaccinated. And here is the White House spokeswoman, Jen Psaki, saying similar thing a little differently yesterday.
50% of the 50,000 hospitalizations in the country came from just 4 states, with Florida being nearly a quarter of those.
Well, the governor of Florida's name is Rick or Ron or something, Bob DeSantis, and here is what he had to say about that.
We obviously have some people that are not vaccinated that have been admitted to hospitals.
All of them.
Are you going to sit there? Are you going to sit there and criticize, or are we going to try to treat and try to help the folks?
Both.
You know, I'm just sick of this judge. I'm sick of the judgmental stuff
really?
On some of this stuff. Nobody's trying to get ill here. Okay, it's a very There's people that were hermits for a year and a half that wore 6 masks and did that and still contracted it. Okay, so let's just be real here, and let's not indulge these things that somehow it's their fault for not doing it. So okay, we'll see you guys later.
Okay, see you later. You did a great job, DeSantis. You're doing great. Yeah, so there's that. Florida's an absolute train wreck. But don't let that stop the senator there and this guy's just the worst. He's a criminal, and he is terrible, and he is the Senator Rick Scott, former governor as well.
So, Trevor, on Florida, I talk to families about the issues they deal with. The biggest issue they're dealing with now is inflation.
Oh, inflation is the big concern. Okay, got it. Loud and clear. Makes a ton of sense. Rick Scott, the jackass he is. All right, let's go back to the White House press briefing and check in with Jen Psaki again.
You will hear the president convey later. If you are not going to be a part of the solution, if you're not going to be a part of saving people's lives, then get out of the way and let other people do the job.
Get out of the way.
That means don't make it harder for people to put requirements on masks or asking for vaccination status into law.
And then we did hear from the president later. Here is President Biden weighing in on this.
The escalation of cases is particularly concentrated in states with low vaccination rates. Just 2 states, Florida and Texas account for 1/3 of all new COVID-19 cases in the entire country. Just 2 states. Look, we need leadership from everyone. If some governors aren't willing to do the right thing to beat this pandemic, then they should allow businesses and universities who want to do the right thing to be able to do it. I say to these governors, please help. But if you aren't going to help, at least get out of the way of the people who are trying to do the right thing. Use your power to save lives.
And everybody thought this was a kind of funny moment when he caught himself with a little bit of a misspeaking here.
Places that have offered the $100, that'd be really good. I'd go back and get vaccinated 3 times.
I'd go back and get vaccinated 3 times. And the final clip I've got for you went really viral yesterday. I saw it in a lot of places. A physician named Dr. Catherine O'Neill, who is the CMO at Our Lady of the Lake Hospital, said that when your families get in an accident, they're not coming to a trauma center like hers because there are no more beds. We have 67 empty beds in our hospital, but we can't find any staff. So many staff are out with COVID-19. This is just one of those consequences that if you have any other kind of issue or emergency or need an ICU bed, for the normal things that happen in life, the accidents and other terrible diseases that affect you, they're all taken up because people haven't gotten vaccinated. Listen.
Yesterday, I drove down 190, which is one of my favorite drives. And we got to see some rice being cut, which my father's a farmer, so that is one of my favorite scenes. We drove behind some people who were driving motorcycles, and it was the end of the day, so it was tolerable. We drove past some kids who were on their four-wheelers. Looked like they were having a great time. Usually that is an incredibly enjoyable drive, and all I could think about was that I have seen people in four-wheeler accidents and motorcycle accidents and farming accidents in the last 2 weeks who sat in their ERs in their small towns. Those are my people. Those are your family members. And when they get maimed today, they're not coming to a trauma center because there are no more beds. We have 67 empty beds in our hospital because we can't find any staff. We have a federal unit on the ground who usually I meet at the PMAC during a hurricane, but now they're inside our hospital and we can't even open beds with them because so many of our staff are out with COVID-19.
All right, that is the audio I've got for you today and a lot more coming your way. Do want to take a moment to say congratulations to longtime listener Arkansas Dave in Georgia. Shout out, little boy, due September 14th. And congrats, Dave, to you and yours. Great to hear from you today. By the way, Dave reached out to me because he thought something happened with his subscription. If you're a paid subscriber to this podcast, just make sure you check your credit card because every month you see a bunch go down because people's credit cards expired. Can't do this without your support. Thank you very much, Dave, and congratulations. Very, very cool. Reached out to a couple of listeners last week. Several of you got on the phone with, and I want to keep that going. If I promised that I'd do a phone call with you, I always enjoy talking to folks, getting to know you, and a lot of people reaching out lately to me. I'd love to hear from you. Just email me, standupwithpete@gmail.com. Ryan in Aspen, you're next. Kevin Gorman, I want to set up a call with you and whoever else. I learn so much from you guys each and every day. But right now it's time to give you the rest of the headlines, the rest of the news, and what we call the news dump.
Fasted, angry chimpanzee acting like a grump, throwing feces on zoo patrons for today's news dump.
Oh, dear. Oh, no. The monkey threw crap on the people? Oh, we never like that. But thank you very much, Pete. Let's get to today's news headlines, everything that's left. Start in New York City. A lot of people reporting this. New York is now going to require proof of vaccination for indoor dining and gyms. Is that going to affect comedy clubs? I think it should, right? About 66% of New York City adults are fully vaccinated, but New York will become the first U.S. city to require proof of vaccination for a variety of activities for workers and customers. And indoor dining, gyms, movie theaters, move intended to put pressure on people to get vaccinated, according to the mayor of New York, announcing that on Tuesday. Also, Tyson Foods and Microsoft announced they, too, will require vaccination for U.S. workers. Another day, several companies, major employers making similar announcements. Who wants to be last? I thought this was a funny and tragic headline. Wall of ice collapses at Titanic Museum in Tennessee. 3 are injured. A wall of ice at the Titanic Museum attraction collapsed, and it injured 3 guests, according to the museum's owners. Those harmed were taken to the hospital with unspecified injuries. The ship-shaped museum closed after the collapse, but reopened for those with tickets on Tuesday, and apparently no more ice fell on anyone else. Who's going to that museum in the first place? In Ohio, in a special election pitting 2 black women against each other, both Democrats, Shontel Brown defeated Nina Turner in was perceived as a high-profile special House election, and I didn't follow that hardly at all, but apparently that's a pretty big deal, pretty interesting and important story coming out of Ohio. What it means, I don't know. I think that one reflected the candidates. I thought that one thing that was interesting is that Nina Turner was like this well-known progressive Bernie Sanders supporter, had about 400,000 Twitter supporters, and Shontel Brown only had 19,000, and yet she still won. And a lot of people were making that point on Twitter last night about how Twitter makes it seem like you're bigger than you actually are, or have more of an influence than you actually do. And another political headline, Missouri Republican Governor Mike Parson announced that he is going to have pardons for the 2 assholes in St. Louis that own the castle, who pointed guns at protesters near their home last year. They were invited, of course, to speak at the RNC. I'll never forget that. That was the height of the insanity and the circus that was the RNC last summer. But yeah, they've been pardoned, so they can go back to their castle with their M16 and their pistol, because there is no God. This is a weird story coming out of Washington. Where's the Pentagon? Virginia? Police officer killed in stabbing outside Pentagon. Officials say attacker was shot dead after ambushing officer outside the military headquarters in Washington. And so shortly after 10:30 a.m., is that, I guess, near a bus station. So I don't know if it had anything to do with the Department of Defense or not. But yeah, that's pretty sad and tragic news coming out of D.C., and I thought this was good news. While everyone else in Congress, at least in the House, went on vacation, Congresswoman Cori Bush of Missouri led a single-handed sit-in at the Capitol building, and she's gotten a lot of support. And it looks like they have extended the moratorium on evictions as a result. And she is getting, I think, the proper respect and a lot of thanks, as well as other Democrats, including Chuck Schumer. But yeah, I thought that was a really interesting and good story. And I always wonder why we don't see more of these kind of publicity stunts from congressmen as she did, sleeping outside the Capitol with a whole bunch of other supporters, including my Congressman Mondaire Jones, Alexandria Ocasio-Cortez, and other progressives that supported her in Washington. And just regular run-of-the-mill folks, I think, that were out there sleeping for, I think, 5 days, camping out on the steps of the Capitol building. So that's great news, and that is the end of today's news dump. All right, coming up, S.E. Cupp. Before that, I've got Dr. Aaron Carroll. But speaking of doctors, it is great that I have access to Aaron, and I can always reach out and ask him questions. But he is my personal physician, and we all should see physicians. And reminded Kathy Griffin yesterday, reminding everybody to get their doctor's appointments, see their physicians. And like a lot of you, I avoid going to the doctor, and especially during this pandemic. And so I'm happy to talk to you about ZocDoc, which is going to get rid of all of your excuses and help you lead a healthier lifestyle. Because when you skip your physical and your dental cleaning, you don't see the eye doctor. Well, everything is starting to open up, at least where I live, and hopefully you as well. And it's time to catch up on your regular health care. So here's what I want you to do. I want you to download this awesome app. It's the ZocDoc app. Easiest way to find a great doctor and instantly book an appointment. I stand by this and everything else that I'm telling you about here on the show. And ZocDoc is awesome. It helps you find local doctors who take your insurance. You get to read verified patient reviews of them, book an appointment in person or video chat, not having to wait on hold with the receptionist ever again. So whether you need a primary care physician, dentist, dermatologist, psychiatrist, eye doctor, or other specialist, ZocDoc has you covered. Go to ZocDoc.com/standup and download the ZocDoc app to sign up for free. Every month, millions of people are using this, you guys. I'm one of them. It's my go-to now, so get on it. ZocDoc.com/standup. ZocDoc makes healthcare easier. And now is the time to prioritize your health. ZocDoc.com/standup. All right, and now my favorite doctor in the entire world and one of my best friends as well. He is now the Chief Health Officer at Indiana University, and he has led their mitigation efforts in COVID, and they just won a huge case at Indiana University. You may have heard about it, to be able to mandate vaccines for students and employees as well, I think, is my understanding. Anyway, excuse me. Dr. Aaron Carroll is a contributor to the New York Times. He is a pediatrician. He has an awesome YouTube channel, award-winning YouTube channel called Healthcare Triage, where he's been doing a lot of really good non-COVID stuff lately. And he's on Twitter, where he's awesome, at Aaron E. Carroll. You should get his books, and you should follow him on Twitter, read his blog. And I'm so happy that so many of you sent me questions for Aaron. I asked many of them and much more. And here we go. Dr. Aaron Carroll right now.
Okay, so you were really fired up, as were several other folks in your world, science and journalism world, about terrible communication last week. And I think that this is having, generally speaking, there's a bunch of headlines we could talk about from NBC News, New York Times, Washington Post, CNN, whatever, that the ratios they're presenting about vaccinated people getting sick are just ridiculous. So it makes it seem like people who are getting vaccinated are having, that there's breakthrough cases everywhere and that they're bad, and they're not reporting that correctly. Is that right?
Well, I mean, it's just that you can spin things to look safe or unsafe. And I think a lot of the ways that we have been reporting on breakthrough cases and on what's going on in the pandemic makes it feel or seem like people who are vaccinated are still at incredible risk, have lots of reasons to panic, and that we need to take drastic action because we're all doomed. And I really, really strongly feel like that misses the point, that it's ignoring the fact that there really is not just one pandemic going on right now. It's almost as if there's two, one amongst the vaccinated and one amongst the unvaccinated. And amongst the vaccinated, it's a completely different world. Very few people are going to the hospital. Very few people are dying. When cases occur, and they are still pretty rare, when cases occur, they're usually mild. It's akin to a respiratory viral season. Amongst the unvaccinated, it's a horror show. It's everything COVID has always been, except more infectious, just as dangerous, if not more so. Terrible. But most of the people hearing the news and reporting the news, and those giving that are vaccinated, speaking to vaccinated people, all the panic I'm hearing is from vaccinated people who are now panicked that they're at massive risk and they've got to take 16 actions. But that's just not the case. What we need to do is get everybody vaccinated.
Here's a headline. CDC study shows 3/4 of people infected in Massachusetts COVID outbreak were vaccinated, but few required hospitalization. Like 3/4 of the people in this outbreak were vaccinated.
But most of the people there were vaccinated. Like if I have 100 people and 98 of them are vaccinated and 2 of them are unvaccinated, and then there's an outbreak and 6 vaccinated people get it and both of the unvaccinated people get it, you'd say 75% of cases were in the unvaccinated. Well, yeah, that's because the vast majority of people were unvaccinated. But 100% of those who were unvaccinated got it, and 6 out of 98 who were vaccinated got it. Those are massively different. And I've just reported on the exact same kind of thing two different ways. I think Provincetown is a phenomenal example of how well vaccines work in a worst case scenario. Not an example of how vaccines failed us, but too much in the news, reported it as if it were the latter, not the former.
Right. So this being Provincetown being a densely populated party atmosphere.
People who were there it's older buildings, poor ventilation, massive numbers of people, bad weather, forcing them inside, tons of people in bars and restaurants, massively crowded together, and I read, first person accounts were like in many ways optimal ways you could possibly transmit COVID. And there was like a super spreader, whatever happened. But okay, very few people were hospitalized. As far as I know, no one died. That's a massive win for COVID.
Right.
Like, it's like, okay, the vast majority of people who got infected, who were still a small percentage of the people there, were just fine.
You said it's a massive
win. It is
win.
not as if this crowded the healthcare system and destroyed everything.
You said it's a massive win for COVID. You mean it's a massive win for science and the vaccine?
A massive win, period.
For the COVID
for the vaccines,
era.
Yeah, I mean, well, I suppose it's a win for COVID too, because lots of people got COVID. But regardless, these things could be spun in different. If we constantly report on the number of there were always going to be breakthrough cases. We knew this. No vaccine is 100% effective, but they are rare, and even amongst them, the vast majority of people do fine. That's a huge win. That's what we want everyone to take part in eventually. And to portray that as a fearsome horror story will only push people away from vaccination and make them more fearful.
So we're just talking about headlines from major media outlets, which, of course, the ones we're looking at should be more responsible. How has the CDC, the federal government, or any agency, the White House, how have they been communicating in terms of a lot of people are talking about miscommunication on masks and masking?
Well, I just think, again, it's just if it were me, the messaging would be constantly over and over again that like vaccines are massively protective. And people who are unvaccinated, we've got to do everything in our power to get them vaccinated. That is how we end the pandemic. And instead, we've spent the last week or two not talking about vaccines, but talking about masks and talking about how everybody needs to be masked. I think that is panicked vaccinated people. I think that this messaging will largely cause people who are already paying attention, i.e. the vaccinated, to put on masks again, which will provide some but limited benefit. It will likely not resonate amongst those who are not vaccinated, who will not want to put on masks. No red states who are on fire because of COVID are suddenly going to reenact mask mandates. The mask mandates that are being reenacted are in areas that are, for the most part, largely safer. So and again, now we spent the last week talking about masks instead of talking about what can we do to get everybody vaccinated. And now it's provided. I mean, again, there are always people who will misconstrue messaging. So I'm not saying that there's any way to avoid this entirely, but I've heard lots of unvaccinated people say, why should I bother? When clearly they're saying vaccines aren't enough and you're going to need the mask up anyway. Why bother?
So when we look at the communication from journalists, the government, something's happening because the vaccination rates have gone up a lot in the last week or so. So is that as a result of all of this reporting together, specifically this new Delta variant and, headlines of people in hot? I mean, what do you think that is?
No, I think there's also been a lot of undercurrent news stories of people regretting that they've never been vaccinated, that as the hospitals are filling up and people are dying who are unvaccinated, and they have story after story of people going like, oh my God, I was wrong. I wish I'd gotten vaccinated. That may change people's minds about vaccination. We're not talking about masks now. We're talking about vaccination. Nobody's saying I wish I masked. They're saying I wish I gotten vaccinated. I also think that, this is, science communication and changing people's minds is often a retail business. It, requires you seeing it with your own two eyes. And when you're in an area where hospitals are filling up, people are dying, and it's becoming more and more likely that you actually know someone who is now saying, oh my God, I wish I'd gotten vaccinated, that might drive vaccination. It probably does. And so it's an unfortunate, but at least comes out in the right way, the fact that when we have massive outbreaks, that usually leads to people taking action, whether it's being more careful or getting vaccinated. They both certainly help.
Yeah, I can't tell you. I mean, how many of these pictures or videos of local news outlets have you seen? And some guy in a hospital bed in a mask and intubated, maybe, with a picture of his family sitting on a table in front of him, and him barely able to get it out. I wish I would have gotten vaccinated, it's like pathetic and awful, but I think it's working. Like, I think those images work as exploitative.
It's awful. It's awful, but again, it's like that is sometimes what it will take. People sometimes become radicalized when it finally affects them.
Yeah.
We talk about this all the time. You see even politicians, they have someone who gets cancer or Alzheimer's, and all of a sudden they become very passionate about, we need to now fix this.
Right.
That is unfortunately sometimes how this all plays out, that you need to see it and feel it before you become, really passionate.
You had a piece in the New York Times this past week, really, really good, titled "COVID is Now a Crisis for the Unvaccinated." We've been talking about vaccines and masking. You write, many may read the CDC's continued focus on masking and distancing as an acknowledgement that vaccines don't work well enough. Leaning heavily on masking and distancing is what we did when we didn't have vaccines. Today, such recommendations are less likely to succeed because they are more likely to be followed by those already primed to listen, the vaccinated, and to be fought and ignored by those who aren't. I think you already just kind of covered this, but
the gist of that is all the stuff we did last year: masking, distancing, hand wash. All of that is good and better than nothing, and it made a difference. But vaccines are better than all of that combined. So it's like, I just wish it's like trying to keep being like, oh, you know what? Why don't we just keep ordering in and no, go get vaccinated. Just do it. Do it. And the previous piece I wrote was just that, we need more mandates, that you got to nudge people in this direction. If you make it the default, people get vaccinated. If you make the default, you got to get vaccinated, most people get vaccinated. There'll always be outlets and some people get exemptions, but the nudges and the default matters. And if we make the default vaccination like we do for schools, most kids get vaccinated. We just got to do that kind of stuff for everybody.
And you said, I don't know what you wrote. I can't find this line in that piece, but you said, what's the difference between mandates for vaccines versus masks? They're mandating masks everywhere, but not mandating.
Oh, well, that was my second thought. I'm like, I literally can't believe, I don't understand why we're willing to mandate masks, but not mandate vaccines. It's like the same kind of thing. It's like, we're not forcing people do it, or you can never leave your house. It's just like, you can't participate in some activities. You can't, if we have a mask mandate for indoor spaces and public places, and then fine, you won't go there. There can be mask mandates too. For vaccine mandates, we usually do it for schools. Hospital systems are doing it. But I can see a world where, you want to go to Disney World, prove you're vaccinated. You could think about flying. Got to prove you're vaccinated. Cruise ships are doing it. They're just, saying you got to do it. The more you have to do it to participate in certain activities, more and more people get vaccinated.
Yeah, it seems like mostly what we're seeing, and you're sharing a lot of these at your Twitter feed, but is that big companies are mandating that their employees who come to the building, I guess, get vaccinated. I feel like mostly that's what we're seeing. And then, of course, your school leading the way, Indiana University. So a lot of colleges and universities as well. But where else will we be seeing them next? As you just mentioned, cruise ships, but theaters and.
Well, recently, Biden just did the federal government, saying basically, if you're a federal government employee, either you get vaccinated or you get tested a couple times a week. I could see Amazon doing this to keep their warehouses safe. I can see, other large company. In fact, I think I have seen other large companies are doing this and demanding it, where it's it's not, we'll fire you. It's do this or you get tested a couple times a week. I think I've seen some schools that are talking about charging those who won't get vaccinated extra. You're going to pay for the testing. There's a lot of ways. Look, the Affordable Care Act had a mandate. It was a tax. It doesn't mean you get held down and forced to buy health insurance. It's do this or pay a fine. There are lots of ways to do mandates. But again, if you set the default at vaccinated, most people will get vaccinated. That's how it works. And so we just have too many places who are unwilling. They're setting the default as either way is fine. And that's not going to get us where we need to go.
So that's mandates. You have an excellent video at your excellent YouTube channel, Healthcare Triage, about passports. What about those here in the U.S.? We're seeing them in Israel, and you made a great point by just the name passport is not great because it's government issued. And
So, I mean, that's one way to enforce vaccination. The problem with that is that I don't want to get into a situation where every few minutes you're forced to show your papers. It's probably easier to set large, high level policy and then push for enough people to get vaccinated that we don't have to do that individual low level checking all the time, except for certain, like if Disney World did it, you needed to go to Disney World. But, we don't want to get to a situation where it's every time you board a train, you got to show it. Every time you go to the supermarket, you got to show it. There have to be, we don't want to be policing an individual behavior, I think, too often. At least most people don't. And that can become difficult and also it's a problem of, logistics. How are you going to do that? Smartphones? Does everyone have to have an app? Well, lots of people don't afford smartphones or don't have them.
Right.
Or, how are we going to mandate, so it's not as easy as people say, but in certain situations, it can be done. Schools, employees, employers, you could do it one time, you're known, you're done. Again, cruise ships, Disney, things that are optional once in a while. You could see how that could, and I'm not even advocating that they have to, but some of them may choose to. But the more institutions that opt for a mandate, the more people will get vaccinated and the sooner this will be over.
On the mandates, let me just go now to questions from listeners. Sheila, I said to everybody, I'm going to talk to Dr. Aaron Carroll tomorrow, and they all got excited and sent questions. She works at a college like you. She says, my question's related to mandated vaccinations for higher ed campuses. My state's higher education system, who's also my employer, just recently came out with a determination that while they support and encourage faculty, staff, and students to get vaccinated, the only entity that can mandate vaccinations is the state board of health, not our board, chancellor, etc. Did you have a similar experience with that decision-making procedure that required the state board of health to make the requirement? What's the process look like?
Well, I mean, I imagine you got to look at state law, but I don't think it. So in our state law in Indiana mandates it for, I think, 6 diseases. I could be wrong, but I think it's 6 diseases. It's the traditional ones, your measles, mumps, rubella, meningitis. And then it says, and then schools should make individual decisions based upon, what they think is best. So that they defaulted that to the institution. So we make decisions. I don't know what state this is. I don't know what state law it is. And maybe in their state, it has to be done by the legislature. I don't know, but who knows? But again, and look, I'm not fun. Some states have already passed laws that say you can't do nothing with COVID. So I mean, if you live in a state like that, you're prevented by the legislature from doing it. So I mean, it is based on state law.
I didn't realize that some states had passed those laws. I want to read about that.
Some states have literally passed laws that say you can't do anything about COVID. You're not allowed to mandate COVID. You're not, the vaccine. You're not allowed to test. Some states have gone way far to you can't do anything.
It's interesting politically when these governors and these legislatures are saying you can't do anything about this problem. And then the problem gets worse and worse and worse to the point where everybody that lives there sees the problem. It's not like anything else, a public health emergency, where you can kind of deny it because it's not in your neighborhood or something. I wonder how have you seen that change politically eventually?
Yeah, I mean, the arguments, and again, I don't like, others should present their own arguments. I shouldn't, but I can't possibly present it perfectly. But I think they'd argue oh no, it's people's personal choice. If they get afraid enough, they'll vaccinate, they'll mask up. It's just, we don't want government telling people what to do. They should get tested if they want to get tested. They should get, it's personal freedom. And that's what's paramount.
I know, but I feel like at some point business owners start to lobby government and be like, hey.
I'm not advocating for it. No, I'm explaining what it is.
I know, I'm just trying to understand how that. I said I'm just trying to understand how that plays out politically, how people's minds are changed, because they start with the point of view that you just, I think, positioned well. But I think it changes as they start to see that they don't have any customers or whatever, or they're every sick and dying.
I wish that were true, but I don't. I mean, I think we've seen lots of examples this year where, when confronted with that they will blame something else,
right?
Or eventually government has to act, and then they blame government. But public health is a tricky beast. Remember there were protests against lockdowns. There were protests against masks. There, at every step of the way, there has been massive pushback, even when this has been a massive worldwide public crisis, and so. But this has always been. I mean, this is not new with COVID too. This happened with flu a century ago. Yep. It happened with smallpox. It happened to some extent with polio. it's always hard because people have very conflicting views about what they can and cannot be forced to do. So it's always a tightrope.
Benny Alexander says, what's taking so long for full FDA approval of the vaccines, and when will 12 and under be approved for the vaccine?
So, I mean, look, I would like the FDA to speed up the pace. Don't get me wrong. And I'd like them to be transparent about what takes a long time. But the difference between full FDA approval and what we've got right now isn't like safety and efficacy. It's a lot of dotting I's and crossing T's. It's like inspecting manufacturing sites. It's, checking for, all these checklists that you're doing the right thing and how you manufacture, how you transport. That takes time. It's negotiations about what goes on the box, what kind of direct to consumer advertising you can do. All of that takes time. It's reviewing tons of forms and going through paperwork. And this usually takes months because it's like slow grinding work and everybody complains about it all the time, but it's one of those safety checks that keeps everything in place. I've also heard, sort of offhand that one concern too is that once a drug gets approved, doctors can start prescribing it off label. And there is some concern about what would happen if doctors just start giving it to babies or small children, because they can do that off label because parents are demanding it and something goes wrong, or, what kind of backlash would there be? So, they're trying to be very careful and at the same time, trying to get it done. But, there's arguments about if they rush it, will people then say you didn't do due diligence and now we don't trust you? I don't know what the right answer is, but I think there's a debate that should be had. I think there are probably ways they could speed this up and talk about how they're speeding it up. Like, we're not doing that work over there so that we can get this done. So everything will get done is going to get done faster. I don't know I don't know what's going on inside the FDA. As far as I know, we don't even have a fully FDA commissioner at the moment. So it's who knows, but hopefully it'll get done soon. They've had months. And I also think that they're working towards getting, EUAs for younger kids, as fast as we can too. I kept saying fall's almost here. So I likely think it'll happen soon.
Here's a question from Zach in Missouri. If the FDA would fully approve the vaccines, could insurance companies start to impose financial penalties like higher rates, or would certifying an FDA chief help reluctance in general?
I don't think that I think at the moment the government has just stepped in and said, we're covering the cost of this. And I think that would likely continue because nobody wants to get cost involved. And again, compared to everything else in COVID and how much money we've paid, the cost for the actual vaccines is like infinitesimal. So, I mean, it's huge for the drug companies, but for the United States government, it's not a big deal. And so I imagine that would not change in the same way that some things are just free, without copays, preventive care, stuff like that. It would just continue to be that way for the vaccines, I imagine.
Ryan says, wonder what Dr. Carroll makes of the unexpected COVID rate drops in places like England. Still bad, but seems like the graphs have surprised. Why? I don't know what he's talking
idea.
about.
I mean, it's like, there's the thing. I can give you some theories, but I don't know what the right answer is. I mean, like some people think that what happens is that this just burns incredibly quickly amongst the highest risk people, the people doing nothing carefully, who are unvaccinated. And then once they've burned themselves out, that the thing just drops really quickly. And that it's like, it doesn't just spread throughout the whole community. It spreads throughout the highest risk people. And once those people have been sort of burned out by getting it and recovering, then things start to get better. Others think it's just natural waves, or that people see the news, panic, get more careful themselves, and that all those individual decisions add up and they start to make a difference. Or people start getting panicked and get vaccinated, and that eventually, it could be any of these things. It could be something I haven't mentioned. We don't know. There's still so much about this we don't know, which is why lots and lots of predictions have not panned out. We thought places were going to burn. Like Michigan was on fire at one point, and everyone thought it was going to spread, and it didn't. It was like it stayed in Michigan, and then it died out. Why? I have no idea. I don't know. Florida's on fire right now. Texas. I mean, we have ideas about them, but how long will it last? How high will it get? I don't know. And what if it just disappears? Everyone will take credit. Everyone will lay blame. There's a lot about this we still just don't know. Here's what I do know. Vaccination is amazing. Everyone should go get vaccinated.
I wanted to ask you on your podcast, is it Healthcare Triage Podcast? Is that what it's called?
Yeah, it's Healthcare Triage Podcast. Yeah. Yep.
I don't know. I thought it was something you might have done at IU for some reason. All of a sudden, no. But you.
It is like we've been partnering with IU the last few years to cover stuff. But yes, it's healthcare trash.
Well, you just here it is. You interviewed a researcher to talk about long hauler, the COVID-19 long hauler stuff, and I just to get people to go over and check that out for more on that. What's something that you learned that was interesting?
Well, I think, it was interesting. She spent a fair amount of time talking to people. Yeah, she spent a fair amount of time talking to people who have, I think part of the thing too is everybody keeps pointing at death rates. Like death's the only thing that matters in life. But there are a lot of people that have symptoms. I mean, forgetting hospitalization and ICU stay, a lot of people get sick and then their symptoms persist for a long time. They don't have taste or smell, which is horrific. You would not want that. They can't exercise like they used to. They get winded. They feel debilitated. They have headaches. And so it's there's more to this than just death. And so even preventing death is super important. But what we really want to do is prevent a lot of these, long-term symptoms or debilitations. And we hope vaccines are going to help with that too, because a lot of people aren't getting as sick as they did. But, you can't just point at death rates. And that, unfortunately, that happens too often when we talk about COVID.
What did you think, or what do you think? Is it a big, long question, or is it simple over the debate about how the research has been done and the Fauci, Rand, Paul thing and saying somehow that, U.S. investment in science and research through NIH in China is responsible for developing this virus and then it got out accidentally? What do you, is that?
I have no idea. This is where it's I don't know. But here's the thing, the NIH spends tens of billions of dollars on research every year. It spends it on all kinds of stuff that people don't know about. Some of it is exploratory. Some of it is, and there used to be every year there was some politician who would find crazy studies. Maybe it was John McCain, and then rail about it and be like, oh, we spend, $500,000 on the sex habits of fruit flies. Right. Well, of course we did, because that's sometimes the basic science work you got to do to figure out some mechanism, and you can spin it as crazy. I remember reading when I was in college that there was some study that showed investigating how pornography caused men to have erections, and I remember thinking duh, but I'm sure they were measuring blood flow or who knows. It's but you could spin it as silly and stupid. Wasteful. But in the same way, I'm sure you could spin it as, we funded gain of function research. We found some of this is important stuff that helps us understand the mechanisms of disease. Doesn't mean you don't got to be careful and have due diligence and everything else, but I'm sure you could spin it in a bad way. But on the other hand, I don't know enough about the intricacies of that to comment one way or the other definitively. But, when we get political about the funding of science, it rarely goes well.
Is it really controversial amongst those who do that science that, hey, we shouldn't be working on developing a virus that could transfer to humans? We shouldn't be doing this because it could transfer to humans.
Well, I mean, of course, that what you just said makes rational sense to a lot of people. Why would you ever study that? And it's if we don't study how viruses do that, how do we develop defenses against how they? So it's I understand people's concern, but it's sometimes you got to do stuff that sounds a little bit. I mean, that's why you have level whatever they call it precautions, because stuff is really risky. But if you don't look at some of this stuff, we aren't prepared for how to have defenses against it.
Luckily, you're one of my closest friends, so you didn't mind my wife and I double teaming you yesterday. We'll just leave that out there.
In some ways, that sounds terrible.
We'll just leave that out there. We had a threesome yesterday with Aaron because...
Phone call.
That's... Oh, yeah, it was a phone call. Obviously, I don't know what anybody was thinking. Ava comes back from camp with her second fever. She had a fever, then it went away for a week. She went back to camp, then she comes home and she has another slight fever. And we think she has Lyme's, and then she has the red toes that are itching, and I find COVID toe itch, and basically we call you, and after we went to our own pediatrician, and basically it's the same thing. Yeah, you were in a cabin with 11 people for a week after basically isolating and hibernating for a year, and you got all of it.
I can't tell you how many times in the last few weeks I've said out loud, people used to get sick before COVID. We've forgotten, somehow that other crap existed because people are getting colds and freaking out. And I'm We had colds before. Like, I don't know. People don't remember. So, I mean, we've all been hiding for a year, 18, whatever long it's been. And we're coming out and people are being social in ways they weren't before. And they're starting to transmit other viruses and illnesses like they did before. So we're seeing upticks all over the place of illness. It's not all COVID, but people are panicking as if it's all COVID. Now, it doesn't mean they shouldn't get tested if their symptoms overlap, because you want to know if it's COVID so you can isolate. But if it's not COVID, people shouldn't be weirded out like that. That's going to happen.
Right. I really appreciate you taking all of these questions. And anything else that's really burning you up that's not being talked about enough? Do you think that's being undercovered because of COVID? Any other public health emergencies or issues that you think are really need to be discussed, like this infrastructure bill that might be providing, expanded Medicare? Anything else that's out there that you...
There's like everything else is still on fire. Like nothing is better than everything is still that was bad is still bad. So it's like at some point we're going to need to be able to focus on other things as well. But we're not out of this. And
maybe
so,
that's that's an idea for
messaging. Get vaccinated so we can get out of this, so we can get back to regular life and start attacking the other things, the other problems that we need to fix.
Maybe we need a healthcare triage video or even New York Times column about all of the other things that still are on fire.
So no joke, I think the last number of episodes we've done are not COVID, and I know the next few episodes we're doing are not COVID because we specifically been trying to be like other stuff's happening. And after all this pivot on COVID, it's like we got to start talking about other stuff. So that has been the focus in recent months, and it will be in the recent future, for the near future. Yeah, because other stuff's still going on.
Yeah, you had two recent videos on like pregnancy myths about like supplements, right? And then the milk and juice video is really good.
I know we got stuff coming out on Aduhelm, if we haven't already, and like Alzheimer's disease, and there's other stuff going on. It's just so hard because we're still dealing with the same problems, and it'd be nice for people to go get vaccinated so we can get out of this.
Yeah, and I look forward to talking.
So they can be safe.
And go watch all those videos right now, and we'll be talking about all those things hopefully again in the future. Thank you very much, sir. I very much appreciate it. Now, offline, you're going to tell me how to relax on vacation, because you're an expert at it.
Do that.
All right, there you go. Say hello to him. Always one of the best, one of your all-time favorites, and you should tweet him right now. He'll see it at Aaron E. Carroll. 2 R's, 2 L's. Read his work, get his books, read his blog, subscribe to his YouTube channel, support him on Patreon. And that's always great. Always great. Also, if you're a subscriber, I shared the video of this yesterday. As soon as I did it, I'll try to do that more for subscribers, for those of you who like video, and adding it to the YouTube page too. If you haven't subscribed to YouTube, go to youtube.com/standup, and please subscribe to my YouTube page. That's free, and I would love it if you did that, and check out the videos. The podcast is there if you want to listen to it as well. It loads up on YouTube as well as Apple and other platforms every day. And while it's free, it's not cheap, so please subscribe. Okay, all right. Now, I'm very excited to bring my next guest on. We always have great conversations. We've known each other for over 10 years, I think, now. She's a political commentator and host over at CNN of S.E. Cupp Unfiltered. She's the co-author of Why You're Wrong About the Right and author of Losing Our Religion, the liberal media's attack on Christianity. She's also a consultant on the HBO show The Newsroom, a regular contributor to HBO's Real Time with Bill Maher, and of course has a column at the New York Daily News, on Twitter and social media at S.E. Cupp. And I caught up with S.E. yesterday and got her reaction shortly after, by the way, the press conference from the Attorney General and then Andrew Cuomo's statement. So I caught her fresh. Also, there was, I'll just hit the interview. I don't think I need to set it up anymore. Here we go with S.E. Cupp right now. So before we get to the seriousness of the allegations and talk all things Andrew Cuomo, S.E., there was just a kerfuffle on Twitter where people were saying your employer had made a bad choice by putting Jeffrey Toobin on to react to these allegations, when in fact it was David Chalian, not Jeffrey Toobin, and everybody deleted their tweets. But I do want to ask you, have you work there, have you ever seen David Chalian and Jeffrey Toobin in the same room?
I have. They are different people. Different people, I promise.
It was crazy how many people were outraged. And I was like, apologize to the Chalian family.
I didn't see any of that, but that's remarkable. I mean, to me, I know David Chalian very well. And I've done a lot of TV with Toobin. And so they don't seem anything alike to me. That is bizarre.
I don't know who started it, but a lot of people saw it. And you know how Twitter is. It's like the worst when you react outraged by a thing that did not happen. It didn't happen. It's
so embarrassing. It is. We've all sort of fallen prey.
Yeah, for sure.
Twitter outrage, and you forget to do your 7 source vetting, which you now have to do to every tweet. And you just roll with it, and you're like, that wasn't real.
All right, so I really want to get your take on this, and it's fresh. It just happened that we saw the Attorney General of the state of New York release the findings of her investigation that Andrew Cuomo himself requested be done. And then we saw a statement from Andrew Cuomo, which was so enraging and so upsetting that it really did make me nauseous to hear what he said. I'm not sure exactly where to start, Etsy, but this is a really, really big deal. And he is not going to resign. And so this is going to suck up a lot more time, as it should, kind of discussing it. But more importantly, we're not going to get important work that the governor of New York needs to get done right now.
Yeah, I mean, a lot about it today made me sick to my stomach. I've been following this forever. And so the allegations, for the most part, were known, although some weren't. I mean, there's 2 more accusers in here than we previously knew, including one, a state trooper who was assigned to protect his office. And the details of the allegations as delivered by Tish James and then her special investigators were graphic and sickening. As a woman, to think that women went through that recently, not 50 years ago, but like recently, and had to suffer through all that. And not just the incidents, that's part of it, but everything else, right? The culture of intimidation and retaliation, fearing that they'd lose their jobs if they said something, wanting to leave their jobs, but fearing that they wouldn't be hired by someone else. All that goes along with this unwanted attention from your employer, from your boss.
Yeah.
Living in that as long as they did, it made me sick to my stomach. And then Governor Cuomo's pre-taped, produced response, featuring like video montages of him kissing lots of people, was another layer of nauseous. Was honestly hard to keep my lunch down at that point, because that was around 1 o'clock.
Yeah.
And there he was, defiant, but also like gaslighting on 11, right? I mean, he was the victim. Women just don't understand him. There's generational and cultural divides that don't understand the kissing. He actually, he was trying to help one woman who had been through a sexual assault by asking her inappropriately about it. And the gaslighting just continued. And so like perpetrating more crimes on these victims, right? And just women in general who listened through that made me furious.
Your tweet was perfect. You wrote after his statement, that was, to put it politely, a masterclass in sociopathic gaslighting by Cuomo. That's worse than normal gaslighting. You wrote, you didn't see what you saw. You're confused and biased. It's you who have explaining to do. I was actually helping these people. My lack of accountability proves I'm doing my job right. Really just reprehensible. I mean, 2 things that really stood out that, I want to, whenever talking about this, I don't want to just sensationalize it and just react to it. I want to, and talking to someone like you who's been open about the issues that you've experienced, the incidents that you've experienced throughout your career. I want to talk about how this happens and how to prevent it happening. But the idea, the story of him with the state trooper, he sees a woman he finds attractive in uniform, says, put her on my detail. They say, you can't, you need 3 years experience. He says, look past that regulation, puts her on the detail. Then he goes about harassing her, including dragging his finger down her spine and whispering into his ear, which, in his defense, is a thing that lots of old Italian people do. Except for the... All right. Now, my producer in my ear is telling me that's actually not something that anybody does and defends with their own ethnic tradition. I mean, it's disgusting that he chose someone to put on his detail and then, I don't want to say preyed upon her, but that's basically what he targeted her.
It's not unheard of that men in powerful positions choose women to groom them and choose them just to make victims of them. When you're a powerful man, you can do that. You can choose who is hired, who is put in your movie, who gets the job at your network, who gets a seat at the boardroom table. And it's horrifying, but women have been in this situation more times than we'd like to admit. And it's so sad because we want opportunities. We want a seat at the boardroom. We want to be in the movie. We want to be at the network, whatever it is. And yet we're put in this position. Do we take a job not knowing why we're being given it in some cases? In other cases, it's pretty clear and it's not as ambiguous. But in some cases, you don't know. And having those lingering doubts, what am I going to face if I take this job? How did I get it? What does he want with me? It's just the worst. And I don't know how to get past that because you and I have talked a lot about Me Too. And this was supposed to be this moment of reckoning. And in many ways it was. I can't locate the progress, though. Where has there been progress for women? I mean, all the women that came out against Andrew Cuomo talk about how hard it was still for them to come out and all the intimidation and retaliation around them. And women who have come out still don't get their jobs back or new jobs. We're still afraid. We're still silenced by NDAs. We're still, going up against these massive corporate machines. I'm just not sure where, what progress or justice looks like. Because what we saw today, I think would scare any woman off of telling. Because, Cuomo's probably going to stick around.
I don't blame you for saying that or feeling that way. I don't want to believe that there hasn't been progress. And innately, it feels like, well, we don't report on progress. We don't report on you not being harassed and have that be a headline. We don't report on there's marked improvement in the workplace necessarily. But it is what I want to believe is that if you gave an older man, especially much less a younger man, the benefit of the doubt that he didn't know that a certain type of behavior or touching was inappropriate, that time is gone because of the work that activists and many others have done, including in HR departments, that most of us, I thought, knew. Granted, I just work in my shed alone, but even when I left SiriusXM, you don't touch, no touching. Maybe at a funeral, you're with a coworker or something like that, and but like there's no touching. There's like that we would learn from these high profile scandals what not to do. I want to believe that. Do you think that there's any argument to be made that there has been improvement? We just don't remark about it as much?
Well, look, the fact that a lot of the allegations against Andrew Cuomo, like I said, are recent, like as recent as 2020.
Right. Yeah. Didn't affect him.
Too. This is not a guy who was sort of frightened off that behavior in the wake of Me Too or learned anything. And this tired generational cultural thing, I know old Italians. I am Italian. Everyone in my family is an old Italian. Yeah. And I'm sorry, yes, there's a culture of affection, but not at work. I mean, this is not your family, 7-fish dinner. This is at work. You're working in the governor's office, you can't keep using your Italian heritage as an excuse for behavior that has long since been unacceptable at work. So, I don't know if Cuomo is the now exception when maybe Cuomo would have been the rule, but I don't know that enough powerful men have gotten that message I think you're right that a lot of younger men coming into the workplace, coming into the workforce, are a bit more nervous about how to act. And I don't ultimately think that's great either, but hopefully less emboldened to just like openly harass women. But I think if you're a man in power and have been in power for some time, I'm not sure you do get it. I don't know that I've seen a lot of growth in that arena.
One more question on this, and this is kind of how I phrased it in a tweet. Imagine a woman coming to work for you because she was a survivor of sexual abuse, and she thought you meant what you said about no tolerance for it in your workplace. And then, as a result of telling you that, she became your target. I mean, it's so deeply upsetting and enraging. And unfortunately, Essie, I would imagine that it happens a lot. It's like you come in and say, listen, I've gone through this horrible trauma. And then for that, you become targeted as somehow vulnerable to more of it. I can't process it, but it certainly is. And then talking about how you understand it, because ostensibly I think he's talking about his daughter, who knows, had gone through something similar. That to me is where I really felt sick, and literally sick, thinking that he did this to this woman and then defended himself by acting, well, however he tried. What are your thoughts on that?
Well, that kind of predation is really, I think that's really singularly sociopathic. And I'm not just using that ad hominem. Like, I mean that. I think you have to be somewhat of a sociopath to do a lot of what he is accused of publicly in front of people. You know, there's something even more sinister about doing it in front of people, which has this like defiant, almost chilling effect, because as a woman, you think, well, he's doing this so openly, it must not be as bad as I think it is, right? Because if it were as bad as I think it is, other people would say something, right, and he wouldn't do it this brazenly. And yet from, Cuomo, Trump similarly did a lot of what he was accused of doing in front of people. That takes a certain kind of, I think, arrogance and hubris and ego and, again, sociopathy to openly target women, take advantage of them in that way, and do it with other people watching, knowing full well, they could tell on me, but ultimately it's going to be them against me, and I'm going to win.
One more question on this, which is, the political question and the idea that it becomes partisan, that because he's on your team, it's somehow okay or it's dismissed. I mean, recent polling in New York State is that like 60% of Democrats still approve of the job he's doing. And this is after these allegations surfaced, not to mention the nursing home scandal and COVID-related scandal, his book, and so on. And do you think that that's going to change in terms of his approval rating? And what would you say to liberal Democrats who might like the job that he's doing?
I think some of that's, always going to be baked into the cake. I will say some progress is visible in that most elected Democrats, both at the local and state level, and then also both sitting U.S. senators from New York, Chuck Schumer and Kirsten Gillibrand, have called for his ouster. And there's been unity around that within the Democratic Party for a while now. And that is progress. That is a way of saying, even when our guy does it, we're going to call it out and say it's bad.
Right.
It hasn't trickled down to voters completely yet, but I know a bunch of New York voters who look at him differently now and will not, give him their vote again. But look, some of this is baked in. And when you have a Republican Party not taking accountability for their guys, whether that's Roy Moore or Donald Trump, and a Democratic Party who has long not taken accountability for their guys, like Bill Clinton and now, Cuomo, then there's incentive for parties to say, well, we're going to protect our own because we know you're going to do the same on the other side. I am pleased by the unity in the Democratic Party around getting rid of Andrew Cuomo.
I'm also pleased by the fact that a Democratic attorney general went after a sitting governor, whereas right now the criticism of the Democratic attorney general at the Department of Justice is not going after Trump and his cronies for the crimes that they committed, even though they're out of office. You see that a criticism from a lot of legal experts and justice, if you will, justice activists. And so I just think that's interesting, too, that, you know, Tish James is a Democrat. She's attorney general, and she's investigating the Democratic governor. A lot of people say she wants his job. Whatever. That's her job to do. And yet we're not investigating, you know, the crimes of the past, which too often we don't look to the past. We just want to move forward because I think there's a lot to see there. I don't know if there's any commentary.
Well, yeah, accountability is important, whether it happens after the fact or in the midst of it. But just to bolster your point, Pete, Tish James was someone that Andrew Cuomo almost hand selected to run for AG. They were supporters of each other. And so this is not someone who's always had an axe to grind with Cuomo. And there are many Democrats who have long had an axe to grind with Cuomo. She's not one of them, which makes it all the more, I think, credible, this report, and independent, because she has put her job ahead of whatever was her, political and professional motivation in, running for AG and receiving Andrew Cuomo's endorsement and, campaigning and all of that. So clearly, she is capable of that sense of independence. And I wish we saw it in other justice departments.
I was planning on talking with you about your most recent daily news columns before this news broke today, and we only have a few minutes left. And I just wanted to ask you, continuing with this theme, you and I can obviously talk about a wide range of subjects and issues as we usually do, but of, let's say, misogyny. I was just outraged by this criticism from a guy named Clay Travis and other people yesterday talking about the U.S. women's soccer team lost a soccer game because of their politics, that this woke virus is destroying sports. And I just feel like that's more of a criticism against women. We heard criticism against, Simone Biles for taking care of her emotional well-being. You wrote a piece about that in the Daily News about, commenting about Megyn Kelly, who you like, but say, it was terrible what she said about the tennis player, whose name, of course, now I'm forgetting
Naomi Osaka,
again. And so what do you say about that? Isn't this mostly targeted at female athletes? I feel like when men do it, they don't get nearly the same type of criticism, or it's looked at differently. But is wokeism a virus that is destroying actual performance of a team?
That sounds like something really cheap and lazy and easy to say if you're that guy, right? It ticks all the boxes, the outrage boxes.
Yes, exactly.
But I don't know that there's any proof that is a real thing, that's a real thing that's infecting athletes. I will say, it's weird in going back to look at the way we've talked about other men who have gone through some mental health stuff publicly in sports versus the women who have more recently. I was trying to find what was our reaction when Michael Phelps came out and started doing commercials, in fact, for seeking mental health treatment. What was our reaction to Tiger Woods, who went through, had some very bad headlines and scandals, and ultimately admitted he had been going through some mental health issues, some dependency issues, sought treatment. I don't think we called him, a wuss. I think we all really wanted him to get help. Things looked not great for a time.
Yeah, I actually did, but it was mostly about his swimming, specifically his performance in the pool and how much better I am than him. But I wasn't talking about his mental health struggles.
I think the times when men and others have not survived those moments. There have been a number of Olympic athletes who took their lives because they didn't seek help, because they didn't skip a race, because they didn't sit out a meet. And I don't think we looked back and just, questioned their patriotism,
right?
Questioned their strength, questioned, their credibility. The way that we're questioning Naomi Osaka and Simone Biles, like, are they lying? Why are they doing this? They just want attention. They must be weak. They're woke. So that does feel a little different in terms of men and women. But ultimately, I just want everyone to stop harassing people who come out with their personal stories, because they're just perpetuating the stigmas that keep people from seeking help in the first place. Because if you're just a normal average person without, a huge platform, without fame, without celebrity and money, and you're going through something, you're wondering, what's everyone going to say if I talk about this?
Yes.
What's my employer going to say? What are my friends going to say? What are my parents going to say? And if these people are your role models, the Clay Travises and the Megyn Kellys and the Piers Morgans, well, you're not going to say, because that is terrible.
Right.
And no one wants to be subjected to that kind of treatment. So I wish everyone just shut up, let these people go through their stuff, and help them. If you have nothing nice and encouraging to say, shut up.
Yeah, no, it's such a really important point. You've been open about your own struggles with when you were younger, and you wrote in this piece, this was so well written, so poignant and important. I want to read it. You wrote, as a parent, all I want for my kid is to not go through the mental health battles I did. But if he does, I hope he's met with nothing but support and encouragement from the people around him, including his larger community and society, not Twitter trolls doubting him and egging him on. Megyn Kelly is needlessly perpetuating the stigmas that prevent people from seeking help, that keep their pain a secret, that can end tragically. You basically just said what I read of your words there. I think it's important because most people aren't public people. Your son, my daughters, who knows what they choose to do with their careers. But your point is, but the people that they work with, the people in their unit, if they're in the military, on their team, those people need to be able to support them and show support and not stigmatize that. And we need to be encouraging of people coming out and being honest about their mental health, not continuing to make a mockery of it. And
not encouraging Naomi Osaka and Simone Biles for them alone, but encouraging them because it affects so many other people who are struggling to see that can happen, that can be met with support and encouragement. It's not just that Simone and Naomi need our help. I'm sure they'll get lots of help and lots of support. It's everyone else who's contemplating coming out with their stories and getting help. We just need to model a good response, as a community, as a society.
And finally, I just want to ask you about your most recent piece at the Daily News titled, How Politics is Tearing Families Apart, Partisan and Cultural Divides Are Estranging Us from the People We Love the Most. This is a piece that mostly, I think, just points to the problem and names it, which is really important because I think everybody knows somebody like this. I haven't had a lot of issues in my personal life. Luckily, my parents are on the same page with me, mostly on politics and the vaccine. But you point to both those, and I'll just use my dad as an example. My dad, 77-year-old Italian guy, he burnt down a whole bunch of his friends for still being Trump supporters. And now he's burned down. He's just quietly, he's like, you know what? I'm just not talking to your cousin anymore because they're not getting vaccinated. And it's so both of these issues that you cover they're both huge tears. Your political support and your stance on masking and the vaccine are tearing people apart. What to do about it, I don't know.
I don't either, but I do know if we don't solve this problem, the future is bleak. I mean, it's one thing. I think we all acknowledge the divisiveness of Trump and then sort of the extremist elements, the conspiratorial elements that he fomented that really tore the country apart. We're dealing with that. We're trying to. But I think what's acknowledged less often is that it's also tearing our families apart. The smallest, most important nucleus is our family. And the story you tell about your dad is a very common one on a spectrum, right? My dad, too. There are things he and I no longer discuss. We still have a relationship, of course, but things we just don't discuss because they're too heated and I don't want to get into an argument with my dad. I don't want to look at my dad differently. And that's tough. And that's on the very, light end of the spectrum. On other ends of the spectrum, there are people who don't speak to their families anymore. Right. There are people who have lost family members entirely to the cult of QAnon or Trumpism or the Proud Boys or the Oath Keepers or the anti-vaxxers and anti-maskers. Yep. All of this is tearing our families apart. And it's a particularly deleterious problem, not just as a conservative for whom families are really, really important institution, but in every community, communities of color and communities, minority communities, older communities, younger communities. If we don't have our families anymore and we keep estranging farther and farther out, I just can't imagine the sort of dystopian effects that will have on our country in the very near future.
Final question. Are you good at taking time off?
Yeah, I am.
How do you, I'm going out for a week and this is a small problem and a good problem to have, but I haven't taken a week off in a couple of years, like a lot of people haven't. And I struggle a little bit to unplug, and I worry that the world not hearing from me for a week, it'll be a lot of people will kind of pause and freeze in place and waiting. Like I worry about them.
Yeah, totally.
So how do you deal with that?
Well, no, the part that is really easy for me is like getting off social media and not really participating in that. That is easy. And if I didn't have this job, I would not be on it.
Same.
Yeah. That's very easy. The harder part is totally disconnecting from just the news, because I actually find when I gave myself permission to keep tuning into the news while I was on vacation, just a little bit, it was actually a huge relief, because I knew when I came back from vacation, I wouldn't have to spend hours and maybe days catching up. That stressed me out on vacation more than like briefly tuning into a little news over the course of the vacation. Right. So I might start the day with half an hour of CNN or whatever, just so I'm a little caught up, and end the day with half an hour of news, and which made me relax more, knowing I wouldn't have, I wasn't missing 7 full days of news and then reaction to news, all that. I gave myself permission to do that. And that really made a huge difference. And so for the rest of the vacation, I'm completely unplugged and relaxed.
And your email guidance, what do you do with that? Do you put on an out of office? Do you check your email when you're on vacation? Because that can also be true. That's also going to pile up if you don't address it. And I don't want to. I don't want to have to address it.
I don't do an out of office.
You do not?
Nope. But I also gave myself permission to check email once or twice a day.
Okay.
I just think, listen, this is for me. For me, it is unrealistic to go off the grid, essentially. As much as I've enjoyed doing that in my life, to go hunting or fishing or whatever, it's just unrealistic at this moment. And it honestly, like I said, stressed me out more to completely unplug. And maybe that's bad. Maybe that is some kind of indication that I'm still not doing enough for my mental health. But what makes me feel the most relaxed when I'm away is like the bare minimum of keeping up. So I'll check my emails. I don't read everything. I just make sure there's no emergency from my boss or something like that. And then I completely put them aside. And I briefly check in with the news, again, to make sure there's no catastrophe or emergency that I'm missing that I'm going to have to sort of get caught up on. That, if the goal is to feel relaxed, and I feel completely relaxed doing this program that I've developed for myself, well, then I think it's working. I think it's the right program for me.
I appreciate your advice, and I would propose a reality show with you and I. We go on a fishing trip together, and our phones are in the middle of the canoe, and we just watch to see who grabs their phone first, and then how it's processed after. As you look, you get to look, and then like the whole rest of the day, they're fish jumping, and you're just like, I can't believe this happened. I got to address this issue.
I know it's not always easy, especially when big news happens while you're away.
No, but I think what your advice is good for everything. Dieting, everything. It's moderation. It's cold turkeying thing is a very hard and sometimes unrealistic thing to do, and it doesn't even work. And so you're saying you moderate your everything, and I think that's good. I think that's good advice, and I will take it.
Well, I think you got to do what works. If tuning out for a full week or 2 weeks or whatever, completely makes you feel recharged at the end and doesn't stress you out, great. Do that. And I know other people who like to keep up with all of it while they're away, right? While they're on vacation. They like to keep up everything, and it just makes them feel good. I don't know. You got to find what works.
Great advice. I appreciate your time as always. I love talking to you. Thank you very much.
Thanks as always for reading and supporting my work. I appreciate it.
Stand up. Yeah, there she goes. S.E. Cupp, everybody. Isn't she a great person to talk to? I'm so happy. We talk about once a month here on the show and have always supported each other, even though we haven't always agreed. And I love her. We've become really good friends. Really cool person. And always great to have joining us. And she always promotes the show as well. She's really a big supporter of my work as well. Okay, so that's all I've got for you on today's show. Tomorrow, I've got Wajahat Ali and Ruth Ben-Ghiat on Friday. I hopefully will have Christian Finnegan and who knows who else. And then next week, very excited to bring to you a whole bunch of interviews, including listener and subscriber Kimberly Kelly, who is on a quest to lose weight on a transition in her life. I spoke with the brilliant April Rain. My friend David Campbell is going to join me, hopefully. So lots of exciting stuff, even on my vacation week. I'm going to keep it coming, keep delivering, even though I'm not going to be anywhere near a screen, I hope. All right, so thank you to my sponsor for today's show, all of you, and then my paid sponsor, of course, ZocDoc. Go to ZocDoc.com/standup. Go prioritize your health, folks. See you tomorrow night at the Hangout. Yeah, what day am I taping? Tomorrow night, the Hangout, if you're a subscriber. Hopefully we'll hang out with you anytime on the Discord platform, and that is it for today. I love you guys. Take care of yourselves, and let's take it away, John Carroll.
You got to rise up. You got to stand up. You got to stare the devil straight in the eye. We got to let him know it's his turn to go. See it clear when all you hear is a lie. So get up off of your butt, get down off of your fence. Even if it ain't a very friendly audience, well, they'll begin to listen when you start making sense. And you stand up, stand up. No need to point your rifle to defend your town. Just stand up, stand up. You know they can't deny you what you're laying down. Boy, you better stand up, stand up. Show your face of every color, yellow, black, red, and brown. She's the place where every lost child will finally be found. There's only one thing to do before we stand our ground, and that's stand up, stand up. Well, the founding fathers saw a land for all. They had to stand up, they had to stand up. They had a keen imagination for a crystal ball, drawing all the plans of stand up. But all they had to go on was the time they were in, with other causes for laws, and since they weren't even sin, they knew that change was gonna come before the change could begin. They had to stand up. All right, they had to stand up. We got to stand up. We got to look the devil square in the eye. We gotta let him know it's his time to go, and make it clear when all we hear is a lie. Why you lying awake wondering where the money all went? It'll be the cost of freedom that'll go unspent. You can see him flee the scene of that experiment if you stand up. All right, we got to speak up. We got to reach up and raise your voice in every way you know how. Don't be toes up. You got to show up. Ain't no better time to do it but now. No need to pledge allegiance to no wanton tribe. Rise up, show obedience to the voice inside, and listen well, and it'll tell you not to run and hide. It says stand.